We have a host of us here today, and so I'd like to do some introductions so that you can know who's here with you. And right now, all of our attendees are muted, but when it comes time for questions later, we can take questions through chat or we can unmute you, whatever's going to work for us. So I'm Deanna Simon. I'm with Oregon Health Authority's Community Partner Outreach Program, and we are very happy to have all of you here today, as well as some of our subject matter experts. Our topics today are going to be the new 7100. We have Christy Taylor who will talk about that. So Christy, can you just introduce yourself and say hello and share something that you like about spring?
Hi everyone, thanks for joining today. I'm Christy Taylor. I'm a Medicaid eligibility and policy analyst with the Oregon Health Authority. And what I love about spring is that it kicks off my camping season. We have several trips planned throughout the summer. And we're new to camping, so it's always exciting to get started.
Excellent. And I will say that what I love about spring is watching things come up from the ground and trying to figure out what they are. And I use my Seek app to try to figure out if it's a weed or something that I want to keep. It's always a big mystery. But thank you, Christy. Camping is a great part of the summer. And we have
Deanna. I see a comment here. There are 16 people in there. Are we supposed to bring people in?
No, we do not have. There isn't a waiting room. This is different than Zoom. So it is a little bit of a small group so far. So we'll see who else attends. But you're right. Thank you.
Thank you. I just wanted to make sure.
It's worth asking. All right. Well, speaking of which, our next topic today after that will be next day, CCO. It's not really next day. We'll clarify that. We've been calling it next day, but it's a little bit, there's more nuances, and Amanda Braxton will be talking to us about that. So Amanda, can you introduce yourself?
Hi, I'm Amanda Braxton. I work under health systems for governance and process improvement, and I was assigned this CCO enrollment project. I'm the project lead. Thank you. And I love spring, and I love all seasons because I love the change in scenery and weather and just the change.
And anyway, I'm now updating it. We have some, not just updates on the 1115 waiver, but we have an implementation project that Colin will be telling us about. So Colin, can you say hello?
Yeah, my name is Colin Sanders. I'm not Katie Beck, but I'm working under Katie Beck for this project. And I'm excited to tell you about what we know about the waiver so far and what we're planning ahead for. My favorite thing about spring, I just moved into a new house, and like Deanna, seeing all the things that are popping up and trying to figure out, do I want this or not? But also seeing our fruit trees in the backyard starting to blossom and hoping that they produce fruit this year. So I'm hopeful.
Thank you. And then the last topic we have, and these might be reversed in the presentation, is some changes to the applicant portal that will be relevant to the folks here at this collaborative, and Christy Taylor will chime in on those. So thank you very much for joining. I think the next thing we have, just the objectives here is for you all to get updates on how things are working for the population that you're serving. To get updates on future changes impacting this population, and really to hear from our processing and policy subject matter experts who are here today. So in addition, in fact, and I'm sorry, Beth, because you didn't have a topic, I didn't put you here, which is my bad. And I'm going to change that right now as we are speaking. We also have Beth Fischel, and I'm just going to say like processing hello. I'll say processing reminders with Beth Fischel. So Beth is with the Justice Involved .5509 email team. So Beth, can you say hello and introduce yourself?
Hi, I'm Beth Fischel. I am the Justice Involved team lead. And favorite thing about spring, obviously the sunshine, because I need the sunshine right now, and all the flowers. I need pretty after the dreary winter. So those are mine.
Thank you. All right. We did want to spend a few minutes on some announcements. And actually I have two, and then we'll open it up for anybody else who has announcements. So my first announcement that's on this screen is that we have 2 navigation coordinator positions open at CPOP. There's a link for internal candidates and a link for external candidates. This position has been open for a while. It closes on April 28th, and today is the 25th. Or is it the 20th? No, today's the 25th, and it closes on the 28th. That's in 3 days. So we just want to make sure you all know about it. I did actually send an email out to this whole group when it was originally posted. So I want to make sure you all got that, and we're looking for great candidates. So that position will be, especially in the beginning, working primarily with Department of Corrections and also statewide to look at developing a navigation program for people releasing from incarceration to make sure they're getting connected to health services and other services that they need. That's the scope of those positions. And I'm not going to spend any time to answer questions about it, but I did want to let you know about it. The second thing that I will let you know about is this is applicable to all community partners. Auto Association launches on Thursday. And I did not put that here on the slide, but I certainly can. I just posted a group site about it. And Auto Association is when a client or a member is connected to another community partner. They come to you for assistance. In most cases, you will be able to connect to them and get them to show in your applicant portal without having to contact workers at OHP. And we posted about that this morning in group site, along with a guide to show you how that works. So I want to make sure everyone is aware of that. And actually, if I can just get a little read from you, can you type into the questions box if you knew that Auto Association is coming this week, or if that was new information to you? That'll help give me a read on how much we've gotten the word out. It was also in collaboratives. A lot of people already knew, but some people didn't. So that's fine. And yeah, it's super exciting. I'd say it's the #1 ask from community partners over time, the #1 most consistent ask. All right, so go to group site to get more information. We're gonna start our first topic with Christy Taylor talking to us about the 7100 form updates.
Good morning. Yeah, so some of you may have noticed or heard, but we don't meet often here. So we have made some updates to our 7100 form recently. Most of them are rather minor.
And to the one system, they're actually in the same section of this presentation. So whichever one you want to talk about first.
Oh, okay. Is that coming up first? Okay, let's talk about the system update. So we're making an update this week that will change the display on the prison jail status information screen slightly. So if you mark yes to the question, has anyone in your household been released from prison or jail since XYZ date that inserts itself? That's just a sample right here. If you mark yes to that question, then it's going to ask, it opens the subsequent screen. And if we have already logged an incarceration record, living arrangement record in our worker portal system, it's going to display that segment for you now on that screen. So see the second sample, yeah, right where Deanna's pointing. It's going to insert the record that we have and the date range that we already know about. It didn't previously do that. And so what happened a time or two was pretty significant, is that a partner and didn't know that we already had a record for someone and entered it again. And what that does is effectively wipes out what we have already logged in worker portal, which already had hospitalized inmate like segments, eligibility segments associated to it, and it historied out eligibility segments that were periods of hospitalization for that person, simply because adding a new record in applicant portal over the top of one we already had, it wiped it out. So what we're doing, this is an attempt to display what we have and ask you to please, if you see a record that we already seemingly have, even if the dates are slightly off, please don't send us a new record. Don't enter a new record. We already know about it. If the date range needs to change, or you notice the dates are wrong or need a correction, please call instead. But don't try to re-report the same incarceration period again. So this is just to make it more evident what we already know about, so that we don't get duplicate records submitted that wipes out what we already have in worker portal. I hope that makes sense.
Let's see if we can take any questions about that, Christy.
Right.
Yeah. Do we call if the dates need to be changed?
Yes, please. Yes.
Or who do we call? So, because you can't call the justice involved team.
I defer to Beth. I don't know. I mean, the main lines, eligibility worker has to do it. So okay. I'm less familiar with the actual phone system, phone tree, and what prompts you enter. I'm sorry.
That's okay. But I think the eligibility worker, the main line.
Yeah.
The CP line. Okay. Thank you.
Mm-hmm.
Are there any other questions about this? All right, I am working on uploading the slides. My system is giving me some trouble, so just hang tight. The number is the regular CP access line. It starts with an 888, and I don't remember it, but I'm sure many of you have memorized it. So if anybody would like to type it, you're welcome to, and I'll share it with everyone. Can the app, can the app be completed if the date needs to be changed?
Can the app be so I don't know the answer to that question. I'm sorry. First of all, if someone is newly releasing, usually that's an unsuspend situation where we just need to unsuspend them. We wouldn't want a full new application submitted. So my first thought about that is if they've recently been incarcerated and all you're trying to do is get them unsuspended and get their medical started again, we would want a 7100 sent to the justice involved team instead. So I think it's going to be, if they never had coverage previously, and this is not an unsuspend situation where you need a full application, then this question also prompts for brand new applicants. And of course, you can submit you can submit a full application. Yes, in those scenarios, I would not expect us to have a record pop up then, because they're new applicant, and that's only going to look back 3 months from your date of request. And it would, does that make sense? So only if we have, if you're applying with a new application with a new date of request, the system asks, has anyone been incarcerated in jail or prison in the last 3 months? The likelihood of a record populating there, because we already had them covered in worker portal, is going to be should be minimal. And if a date does populate, that's probably an indication that they did have previous Medicaid and we just need a 7100 instead. I kind of talked around that because I had to think quickly, but I would anticipate brand new applicants who did not have previous coverage, nothing should show up there.
And so I think you answered the next question, which is we don't need to update anything in one when we normally use a 7100 form. If you're using the 7100 form, continue to do that, right? This is only when you're using the one system.
Correct.
Okay. And then if a date does need to be changed, we talked about calling and using the CP access line, but can community partners also alternatively email the 5509, the Justice Involved 5509 team as another way to do that?
I defer to Beth on that. I mean, JIS sisters have access to get help from the Justice Involved team, so I would think so, but she monitors the email traffic there, so.
Yeah, so Beth, if people need to change that date, we know that they can call and talk to an eligibility worker. Is an option also to email the Justice Involved team?
Yes, I mean, it's always an option as long as you're a JIS sister to reach out to us for someone who's releasing.
Okay, great.
Like Christy said, though, I'm not sure how often this is really gonna come up. So if we see like this huge influx for some reason, we may have to reevaluate the statement, but I think we're fine for now.
Okay, thank you. And then what if it shows in one that they're still incarcerated? Is that the date change that you're talking about, Christy?
I admit I'm not sure if the record's going to display if the release date isn't entered yet. It might. That is a clear indication that this is an unsuspend situation, and we would not want a new application submitted. If we have a start date and no end date, even if they were released anytime in the last 12 months, we would want them to be reported on a 7100 so we could restore their coverage back to the release date.
Okay, and then one last question, and then we're going to move on to our next topic. And gosh, I just realized I'm not sure I understand this question. Let me fumble through it. Can someone from another county change or edit an application from the client's primary county, or will that cause issues? And I'm not sure if I quite understand that. Maybe you do better than I do, Christy.
Not in the context of unsuspending someone. So in the context of maybe what you previously mentioned about the new functionality where you can do a global search, you can find a member that with an open existing case, you can auto associate yourself to them. Yes, it's possible that any other community partner could associate themselves to a case and make updates. And if that's the case, then you would have to reassociate yourself again if you needed to go back in and make new updates.
Yeah.
I don't know if that's what that's getting at, or if it's more specific to what we're talking about here about the status screen.
Yeah. And I'm not sure that the county where you're really makes a difference here. So I'm going to move on from that, and we can clarify later in the questions box if we need to. All right, but thank you for that update, Christy.
Yes, so the next thing is we did update the 7100 form. Most of our updates were pretty minor, just updated some logos, headers, agency references from, let's say, OHA to ODHS, who actually does the eligibility work. But of note, one of the things we updated on the form just to avoid confusion is the limiting condition that we had previously had at the top that said the form was only for use for those under age 65. That's no longer the case, as most of you know. The 7100 form can be used for anyone who is being released from incarceration. So that's no longer a limiting factor. We also definitely, the biggest impetus for updating this form was the correction to the email address. So please note the new email box that all of those forms should be sent to. We replaced, for respectful language, the word inmate with individual, as we've also done in our Oregon administrative rules recently. We updated the attachments box at the bottom. One of the options in that box was proof of other health insurance, which really just never ever comes up. So we removed that as an option and instead added a box that you can check for the consent form. If you're submitting it along with the 7100, you can check that box on there. And again, as a reminder, that consent is not necessarily required with the 7100, but if you want to be associated to the case on an ongoing basis and or desire a status response from the eligibility team, we would need the 6610, the authorization for community partner help, the long title, the consent form, updated, included in your email. And lastly, but not to be forgotten, is that we did add a CCO preference box now on the form as well. And I'm going to say this every time we bring this up. It's really, really important that CCO choices are never chosen for individuals. The individual themselves must always be the ones making the CCO choice if one is indicated on the form. It must be with their permission and by their request. But sometimes that is applicable, and we certainly want to honor it whenever we know that they have a particular preference, especially if they're trying to go right into certain types of services, etc. So the next slide actually shows a quick example of the forms, the old version and the updated version. And I know it's tiny, but I just want to call out the locations on the form. So you'll see the top box where the new email is now referenced. The CCO preference is down in the individual information box. And at the bottom, you can see where the attachments box is, where you can check if you're sorry, I just say uploading. I don't really mean that in the system. If you're emailing and including a copy of the 6610. So any questions? That was, you probably already were pretty much familiar with that, but I wanted to call attention. We certainly will continue to honor the old version as received, but as you can start using the updated version, that would be best, please.
Great, and I just updated the newest version to this webinar, but it's always best to grab forms from the forms server because that is where the most updated version of the form lives. So the way that I like to get to the server is I just type into Google OHA DHS forms server. It's always the first thing that comes up, and you just type in the form number, and then you know you're getting the most recent version, but it's uploaded for you as well. Right, are there any other questions for Christy about the 7100 form? Okay, I just want to thank you, Christy, for working with the powers that be and the right individuals to get the CCO request on there. I think everybody knows that that needs to come from the applicant or member themselves, but it's will make things much easier. So thank you. That was the biggest request with that change.
No problem. Thank you.
All right, and next, we have a couple reminders from Beth Fischel with our Justice Involved email team.
Hey guys, just real quick, if you could please, pretty please, when you're filling out the 7100s, make sure that you're clearing off all of the previous information from whoever you're assisting, and or make sure that the information you're adding is accurate. We're starting to see an increase where like we have a name and a date of birth that match, but the social security number and prime belong to somebody else, or the birth date's off. Just makes it a little easier for us if all four points are accurate, or if you aren't sure or you don't have it, you just leave it blank and we'll do the best we can. It's much easier than trying to figure out who belongs with what. For now, we're processing and getting it taken care of, but if case reviews, quality control, quality assurance happen to pull one and review it, it could potentially be an issue ongoing. So maybe, I know everyone's in a hurry, but just slow down and check for accuracy to make life easy for everybody all around and prevent delays.
Yeah, Beth, I think you're being too nice. But it sounds like there's a kind of a process that people are going through where they have a 7100 filled out and then they just write over that information for the next person. And so maybe it's a best practice, or maybe I'll ask you guys, like, what is your best practice to make sure that you don't end up mixing and matching information from different clients. I mean, is that what's happening? Is that you're just using a standard one and you're writing over it? Or maybe somebody can help illuminate how this is happening and therefore how to avoid it. Because the justice involved team wants to stay committed to responding quickly. And the more that they have to sort these things out, it's not just a compliance issue, but it can also be a timeline imposition. A blank version every time. I have my information filled out in the box, and then make copies of that, but leave the client part blank and do a new one for each client. Okay, thank you. Is there a Word document version so people can electronically fill it out and then save it? That might make it easier. Christy, do you know if there's a Word version? I didn't see it on the form server.
I haven't seen one. No, I don't think we do. I think the only one we have posted is a PDF right now.
Okay. Something that people have done in the past, I don't know if it works for this, but they've done it with things like consent forms. You might have a laminated copy and dry erase markers. You would need a really fine tip dry erase marker, but then you could, there are some things that are always going to be filled out the same, like your assister information, and that could just be printed on it as standard. But then all of the fields that get changed, after it gets laminated, get put on that laminated sheet with a dry erase marker, and then you just erase all the dry erase marker every time. That means you don't have to refill in all the redundant information, but all of the flexible information gets erased easily. So that's something that folks have done that I don't see here in the list. Mostly people have done that for a consent form, but I think it really applies to the 7100 as well. Sarah, you say that you're working on that at DOC. Have you come up with any solutions? Tillamook County says that a good practice is a blank form with the CP info, and then you save as and you rename it every time. But anyway, I think it's been heard from Beth that that's a real issue. So let's make sure that that comes through cleanly so we don't have compliance issues and they can stick to their quick timeline that we're all used to and very appreciative of. For those of you who can't edit in the PDF, then that printing out and laminating might be an option. Okay, should we move on? I'm going to move on. We already took questions about that. So we'll move now to Amanda Braxton. Thank you for being here with us.
Thank
to
you.
talk about CCO enrollment timelines might be changing.
So as Deanna indicated at the beginning of the meeting, we're calling this next day enrollment, but we're finding that some people are getting confused because it's not really next day. It's next business day. And what happened is, a year ago, over a year ago, we're discussing this project and we wanted it to be pretty quick. And it actually started out the same day and then next day and then next business day, because technology just isn't where it's needed right now. But maybe in 5 years we'll be doing same day, who knows. But so today I'm going to call this the CCO enrollment improvement project. So currently what we're designing right now for a change in MMIS, Medicaid Management Information System, is that we want to design a process where we enroll new and transitioning people within 2 to 5 days rather than the current 5 to 11 days. So we're essentially going from weekly to daily, with quotes around daily. But it's speeding up by half because we feel if they're enrolled in their CCO more quickly, they can access their services more quickly. So improving access to the coordinated care services, to their medications, things like that. And our goal is to have this implemented by January. And the project, so January 1st, we want to implement this change request. We're working on doing that now. We're designing right now. So maybe that date can change, but that is the date that our leadership at OHA has assigned us. Another important part of the timeline here for this change is that we are doing a slight rule changes to change it from weekly to next available enrollment date, removing those pieces off the rules, modifying those, and that we're having our public hearing. I'm filing the rule notice in August and having the public hearing in September. So if you want to reach out with questions, feel free to contact me, Amanda Braxton, and I can reach out back to you. Thank you, Deanna. That's it for my updates.
I do have a question. When you say next available enrollment date, do you mean next business day, or is that referring to something else?
Yes, next
Okay.
business day, essentially, Monday through Friday.
Thank you.
And so what I'm finding, and then someone had a question here, where does 5 to 11 days happen in our area? You know, I thought that too, and I researched it, and
I think I can
so,
take that if you want,
yeah,
Amanda.
go ahead. Thanks, Christy.
I think I know where this is mostly coming from. So in practice, if someone is currently enrolled in a plan and requests a new plan, disenrollment timelines are longer. We will disenroll from one plan in one area effective end of month, sometimes, or weekly, and then start their new enrollment in their new county the following month. So the next day enrollment that Amanda's talking about is really when someone does not request, is not currently eligible and enrolled, does not request a plan, well, can request a plan or not request a plan. It's when our system implements auto assignment. So, or is someone's not currently enrolled and chooses a plan and the system enrolls them for the first time. That's when they would get the effective date of like next day, the next day. So it's never going to be in situations where someone's currently enrolled and needing to change, or currently enrolled in one county moving to another county. The time frames are different for that. This is talking about when our system assigns brand new applicants or people who haven't been enrolled previously.
Thank you, Christy. You said it better than I ever could have. And correct me if I'm wrong on this, Christy's. There's a question about, will they be made fee for service? Sorry, I lost the question now. Darn it. Let's see here.
I just flagged it.
Okay, thank you. Something about fee for service. Yes, they will be, when they get enrolled, they will be fee for service until that 2 to 5 day period. Okay, thank you, Christy. Any other questions, Deanna, that I did not see because things were moving fast here?
If a person moves, just a confirmation, if a person moves, then they have to wait until the end of the month.
Want to answer that, Christy?
I don't want to, so there are some things happening that are very confusing with the system right now that we have heard from community partner groups. And I want to say we're currently researching that sometimes they get, if someone moves from one county to another and is enrolled, sometimes they are disenrolling overnight as expected, sometimes they're not. And we are trying to research the various scenarios to understand why it sometimes happens that way and why it doesn't. So we understand there's some confusion around that right now. So I don't really want to talk too much about it until we have more information about what's going on and how to advise.
But what we can say is that the intention is that if somebody is moving to a new county, needs enrollment into a new CCO, and they report that non-eligibility update, we expect them to be disenrolled overnight and be on fee for service the next day until they get enrolled into that new CCO. That's the expectation. We know there are some snags in that at the moment. You can always
that is the intention, yeah.
Right.
And next business day. I just wanted to say that for the recording.
Oh, thank you. You can always call the client services unit if that has not happened to flag it, and they can help you. That's who you would call for issues with disenrollment when somebody has moved or is getting a different CCO enrollment. All right. Thank you, Amanda, for those updates and for the opportunity for folks to ask some questions. And know what to expect. Right, so now we already dealt with questions. We're going to move on to Medicaid coverage in carceral setting. Oh gosh, so yes, this is Colin's presentation. I didn't mess up with Katie Beck there again. They're partnering on this project. And now I'm going to turn it over to Colin Sanders with OHA to talk about this project and his implementation efforts.
Thanks so much, Deanna. Quick time check. How late does our webinar go today?
We go until 10. So you have, if you could keep to like 13 minutes, we have a couple minutes at the end to wrap up.
I'll do my best.
It's pretty short and we can always invite you back. So.
All right. Yeah, let's go ahead and go to the next slide then. So we have asked CMS, Centers for Medicare and Medicaid Services, for a waiver for lots of things, but specifically for carceral settings, so Medicaid coverage in carceral settings. We did ask for that and we are waiting for approval. So if we go to the next slide, we can learn more about what that timeline looks like. You know why we're doing this, I hope, or you can come back and look at the slides, but it's gonna help improve care. Right now we're looking at both prisons and jails, including tribal jails and youth facilities, as well as state hospital aid and assist competency restoration. So that's the areas we're looking at. Let's go to the next slide. So very recently, CMS has proposed a two-phased approach. Lots of states are asking for this year, and what they're basically doing is trying to figure out what's the same and what's different among the states, and they're going to approve all the things that are the same kind of at the same time, and then the things that are different will go in order. And Oregon is going to follow that model. States that choose to sort of opt out and want their request considered uniquely have to wait until everyone else does it. So Oregon's opting into the phase 1, phase 2 approach. So we may have some differences in sort of implementation timelines, which we'll learn more about. Let's go ahead and go to the next slide. So here's that timeline. We're working on the anticipated approval of phase 1, and then things are going to keep moving forward. Our goal is to have everything approved by January 1st of 2025 because there is a Medicaid requirement coming into place around youth under 21 in carceral settings getting limited benefits 30 days before release. What we're asking for is everyone 90 days before release, and that would include that smaller population. If nothing else, that smaller population will end up being a pilot project for us, but the goal is that everyone gets the same benefits at the same time. So something to be aware of, more to come. I really can't say a lot more, but the goal is that everyone has the same benefits. And if it's not going to be that way, we'll let you know. Let's go to the next slide. Okay, so very timely, very important. If you haven't already heard about this Carceral Negotiations Advisory Committee, I'm telling you about this Carceral Negotiations Advisory Committee. Katie Beck is looking for more participants. This is specifically starting next month to start reviewing our negotiation request with CMS for that phase 1. And on the next slide is going to say who we're looking for, which justice involved collaborators are included here. So if you're interested, please email Katie Beck. Her email's on the previous slide. And actually just go back real quick. Sorry to make you go back and forth. It looks like it's meeting every 2 weeks to review materials, and it's going to go through 2023 and 2024. So please send an email to Katie ASAP. She says that the deadline is today, so maybe hold to that, but I think she's also on vacation, so maybe it doesn't matter if it's today, but she didn't tell me that. I just know that she's not actually here.
Yeah, and this
All
is
right.
a decent ask for folks where this is on top of their existing work. So they may need more than a day to process that, but I would just be in communication with Katie. And if you know of anybody else who are in one of these categories, right, you maybe are working with a jail commander who might want to weigh in. If you can spread the word, these slides are posted, and I can also send out a separate email about this if I have time.
Yeah, and this, we did actually present to jail commanders last week, this
Good.
same content. So,
Excellent.
all right, and let's go ahead and keep moving forward. So my role is implementation. So I am working really ahead of the curve to sort of figure out what's going to happen once this is approved and we're beginning to implement it. So we want to really center community engagement, which includes both that sort of pre-implementation negotiation committee, but then we're also going to convene a post-implementation or post-approval implementation committee, which may have some of the same components and folks, but may be different as well. We'd also like to do some sort of general information and education about the program. I'm not going to really engage in the questions here, but one of the questions I have for you is, what other things would you like to see in our engagement plan? And you can email me or Katie with those ideas, or Deanna, and she'll get it to us. So just generally speaking, what else would be helpful? Community education is a really broad topic. So if there's things that you think specifically would help, let's think about that later and keep going through the slides now. So who we want to include, we want to include people who are currently incarcerated, which has some logistical challenges. So the question is, how do we make this work? This is my pipe dream at this point. We've got time to figure out how to make it work. So if you have ideas about that, please let me know. We also want to include people who've been recently released from incarceration, carceral setting staff, coordinated care organizations, healthcare providers, community-based organizations, including justice-involved assisters. And then if there's anyone else that we're missing, please let me know.
So Colin, would you like people to comment a little bit about how to reach people who are currently incarcerated, or people who have just released, and maybe type that into the chat a little bit, because we can pull that chat box or that
Sure.
questions piece later?
Yeah, that works. That works great.
Okay.
And let's keep moving through. So this waiver, we're asking for a limited benefits package. It's not everything. The things that it includes is case management, physical and behavioral health consultation, laboratory and radiology services we've asked for from CMS, but they didn't approve in California, I don't think, which means they may not approve it for us. We are asking for help with medications and medication-assisted treatment for SUD, and as well as making sure that there's a 30-day supply given before someone leaves incarceration. Let's go to the next slide. And then we're looking at making sure that community health workers and community navigators are able to be paid by Medicaid to provide navigation services while someone is still incarcerated. So that's another one that may be a bit more difficult to work out at several levels, both having providers that are credentialed and making sure that they have access to people that need their help. And let's go to the next slide. One of the requirements of the waiver is that everyone entering a carceral facility must be screened for program eligibility, meaning Medicaid eligibility, if they are not already enrolled. So that looks like actually submitting a new application for everyone entering an incarceration facility in the state of Oregon. And so some possible workforce to consider would be the carceral settings staff, and they've already told us that that's not going to work with their workloads. Potentially state eligibility workers, or really leaning on justice-involved community partners like all of you. And each jail or facility may also come at this a bit of a different way, but these are the people that we know can serve this population. It's a question of how do we support any of these groups to be successful. Let's go to the next slide. One thing to keep in mind is that we learned that most jail stays, like 95% of jail stays, are less than 90 days total, which means that for most people entering a jail, their benefits would never actually be fully suspended. They would just be changed from one benefit package to another. But we also know that the exact release dates can be difficult to pin down, and some people may serve sort of additional sentences quickly, and so there's an open question with CMS if we're counting it their 90-day before release, even if they're actually not incarcerated for like less than 24 hours. We don't know yet, so that's what we're trying to figure out. The state's goal is to maximize coverage. So if we don't know that someone's going to be incarcerated for 90 days and we don't think that they will, we can say, okay, we're not going to suspend your benefits. But then if we learn that their sentence is actually 91 days, okay, well then we need to figure out what day in there they don't have coverage. Interesting things to work out with CMS. Let's go ahead and move on to the next slide. One thing that I would really like to see is being able to develop a peer facilitated training program while people are still incarcerated that's really just health systems navigation, how to make sure that those follow-up appointments are completed, how to make your own appointments, how to contact your CCO, how to schedule a ride with any MT, all of these things that are going to be most successful in people utilizing their benefits, and trying to do this while someone is still incarcerated before they're released. So there's a lot of operational challenges to consider. I'd like to hear what your thoughts are on how to make this successful. I've got some background in developing this type of content, so the content part I've got down. I'm happy to hear what things should be included, but really the actual operationalizing it, that's the
Right.
tricky part.
How do we launch this educational program to folks who are still incarcerated so that they can pre-think how they're going to be utilizing their benefits upon release?
Yep, exactly.
Right. Yeah. And so I think that's the next thing. We did get a couple good ideas for engagement. If anybody has ideas about if there's an existing program for education and, you know, kind of this ongoing learning for adults in custody in a jail or in a prison, if you can let us know. Maybe Colin can reach out and say, oh, hey, you're doing something like that at your facility. Can we talk about it and how it works? Or any other thoughts that you have, if you can put them into the questions so that Colin can see those and maybe do some follow-up.
Yeah, thanks so much. And then I think I just have 1 or 2 more slides. So transitions of care, once someone is released, making sure that ongoing care is happening. So connections with the CCOs are crucial. To what extent do you all need to be connected with the CCOs if you're not already? This was actually a question really meant for the jail commanders. I left it in here. But then also, Deanna, I know that you were just talking about a new navigation program that's being hired for right now. So that'll also be part of this transitions of care.
Absolutely.
But this program's not starting for like 2 years, something like that. And I don't remember if your positions are LDs anyway or permanent. So
They are permanent.
we'll see how that all lines up. Oh, they're permanent.
Okay.
Great. Awesome. And then I might just have one more slide. Oh yeah, so in order for this is a demonstration waiver, meaning that we're getting approval to do it for 5 years. And then after that point, CMS can determine if we get to keep doing it or not. So we need to make sure that we're measuring some key outcomes. Those 4 in the middle that are in bold, Medicaid enrollment rates, recidivism rates, engagement in services, and health outcomes are ones that CMS has listed as priorities. But the other things we might be interested in as well is how many assisters do we have? How many peer navigators do we have sort of pre and post? And then any qualitative outcomes from members or partners. So just hearing from folks, was this a good service? Was this helpful? What else would you want to have in it? And if there's a last slide, it's probably just contact information. But I think that might be it for me.
Okay, and I just got a message that somebody is having a hard time accessing the questions. It should be in the control panel under the orange arrow in the upper right-hand corner of your screen. There's a questions thing that you can pop out with a little square that has an arrow. So hopefully, if you have comments here, you can drop them in the questions box. I want to go back to this peer facilitated training and training while folks are incarcerated. And since we have an extra minute, Colin, did you want to spend some time, maybe just 2 minutes, getting any input on this?
Yeah, if you can take a look and see what's been put into the questions box already.
Really nothing, which is why I wanted to come back to it. So Amber Richards is saying, I have direct access to adults in custody in Clackamas County, providing peer support and case management. And so I think, you know, the question that I'll ask again to this group is, are there examples of successful programs where there's maybe like groups of AICs or peer groups of adults in custody with an educational effort of some sort? Because the idea is have, you know, peer facilitated or other facilitated trainings within the carceral setting to help people talk about their health coverage, what it means, and how to access it upon release. Are there any existing programs, maybe not for health coverage, but for something else, that are successful that Colin might be able to talk to you about to start to get a handle on what this could look like in different facilities and how the differences might show up through different facilities? Okay, Memo is saying that in Salem, there's a good example. So so far, there's 2 people to connect you to. Colin. Is there anybody else who Colin should connect to for successful programs, either for peer facilitated trainings or other trainings while incarcerated? All right. There might be a few more, so Colin, we can make those connections afterward for you.
Thanks so much.
Okay, thank you. All right. And I think that is really concluding our Justice Involved Collaborative. Are there any questions for Colin in our last minute or two? I haven't seen any here, so. I think really this is just an update for all of you. We know that this is very near and dear to your heart, so we wanted to keep bringing updates, even though it's not a complete program yet. We wanted to keep you abreast of what's going on along the way. So I want to thank everybody for coming. You can always reach out to myself if you have any questions. There's always the Justice Involved at .5509 email team if you need help with cases. And we have this meeting quarterly. I will send out this slide deck along with a copy of the recording, but you also have the slide deck in the handouts section of your control panel. You also have the updated 7100 form. So I want to say thank you to everybody for being here. Reach out if you need to, and we'll continue to be in touch.